A very good morning to you. We start with breaking news, and in the last few minutes, the NHS says it's being hit by a tidal wave of flu hitting hospitals. New data released by the Health Service says staff are now dealing with unprecedented winter pressure. The number of cases in England of patients with flu has increased by 70% in 1 week. 1,861 beds were occupied by flu patients on average each day last week in England. That compares to 402 in the same week last year, which is an increase of 363%. In a statement just released by the NHS National Medical Director, Professor Sir Stephen Powis, he said the tidal wave of flu cases and other seasonal viruses hitting hospitals is really concerning for patients and for the NHS. The figures are adding to our quad-demic worries. Let's bring in our health correspondent, Laura Bundock, who joins us now from Whipps Cross Hospital in northeast London. Laura, those numbers in percentage terms are astonishing. In absolute terms, are they a little less worrying or not?
No, I think speak to staff here and they will tell you it is a very, very challenging time for them. They said, look, last winter was the most challenging they'd ever faced. This winter is already matching that, and we are weeks away from what they would expect to be the peak. So you're right, flu cases are on the increase massively. We've heard about this quad-demic. It's not just flu, it's COVID, it's norovirus, it's RSV. There are these 4 respiratory infections that are causing huge pressure on hospitals like Whipps Cross here. And the problem they have here and in hospitals all over the country is that they can't isolate the patients. So only 13% of the beds here are single occupancy. So once you get more people with more of those sorts of infections together, the likelihood of them spreading and causing more contamination increases. So overall, we know that flu for the last week is up 70% in terms of the number of people who've been admitted to hospital with flu. November was the busiest November on record, and especially for A&E, and that, of course, unsurprisingly, that's caused a slight increase in A&E waits. 2.31 million attendances at A&E, at 7% higher than last year. The clinical teams, though, are seeing more patients, but we're hearing here that there are patients coming with more complex, multiple problems, so more than one condition, meaning that they'll end up staying here longer. Another big issue is ambulance waiting times, and you only need to walk in the corridors behind me here to see the number of trolleys stacking up. The ambulances have brought patients to the hospital, but it's that handover time that is taking longer. All of them should be done within 60 minutes, with 95% of people who arrive in an ambulance being handed over within 30 minutes. But at the moment, 35% are taking over 30 minutes, and it peaked at 41% last Monday. This is a lot higher than they would expect. Speaking to the staff inside here, they say they're doing the best they can with what they have at the moment, but this is going to be a very challenging time for them.